everyone and welcome to Rad Chat. My name's Jo McNamara and I'm joined by a fellow host, Norman Joel Canterson.
Hi everyone.
So we are here live at UKIO in the pod box and we're joined by another lovely guest. Would you like to introduce yourself, please?
Yeah, so my name's Wilkinson and I'm a Senior Talent Acquisition Partner at GenesisCare.
Sounds very, very exclusive. What does that mean?
So I'm basically, I suppose in layman's terms, responsible for recruiting at GenesisCare. So obviously people that apply, I'm usually their first point of contact. And equally, you may find me reaching out to you on LinkedIn as well.
That's how you acquire the talent.
Yeah, usually applications, reaching out through obviously LinkedIn, so sourcing people, I suppose you could say, and equally as well, we do have a lot of traction internally as well through referrals. We have a really fantastic referral scheme at GenesisCare as well.
Amazing. So what is GenesisCare for anyone out there listening who's never heard of it before?
Yeah, so sure. So we are a network of outpatient centres, very state of the art, and we, kind of really cater for, I suppose you could say, almost the full pathway, everything except from, surgery. So that is diagnostics, so MRI, PET-CT. We also do medical oncology, so chemotherapy, and also obviously radiotherapy. We are really proud to have an MR Linac at 3 of our centres. That is Guildford, so GenesisCare Surrey I should say, the Cromwell Centre, which is in partner with the Bupa Cromwell, and also our Oxford Centre as well.
How straightforward is it to get a referral for MR Linac treatment?
Good question. I mean, I'm going to be honest, I'm not a trained radiographer, so I'm probably not the best person to
That's fine.
to ask that question. I don't really deal obviously with the referrals, as like I say, my focus is purely bringing in the people that will know the answer to that question.
So from a workforce perspective, how do you operate as it is at the moment? Is it as fully staffed as the NHS? Obviously, we're really short staffed.
Yeah.
From a GenesisCare perspective, how do you operate?
How do we operate? So you mean in terms of
just numbers? Do you have a workforce shortage?
I wouldn't say we have a workforce shortage. I mean, I think obviously the market, in the UK, there's obviously a lot of people definitely probably leaving the UK, a lot of returning home and things. So I think like everyone else, there's been some struggles, but obviously we always look to obviously retain really good staff, and that's something we're really proud of carrying on and trying to do. In terms of, just trying to think of, what was the question again? Sorry.
I'll rephrase it. Do you have any job opportunities at the moment that people might be interested in hearing about?
Yeah, so we have a position actually, at the Cromwell, which is a really key one for us at the moment. So we have a role as a lead therapy radiographer based at the Cromwell Centre. So the Cromwell is kind of a, like I said, really state-of-the-art radiotherapy centre. We have Gamma Knife there, an MR Iridian, so MR Linac, and then we also have a Variant Edge as well. So we're really looking for someone there, so a really experienced radiographer, but equally an experienced leader, someone that's used to managing the day-to-day, often kind of challenging situations. It is very obviously kind of, I suppose this is the case that we do treat are very complex, so we need someone that can come in, I suppose, kind of a ready-made leader in a way.
And any other job opportunities available?
I suppose, I was going to say, I suppose really exciting for us next year, we are going to be opening a centre in Leeds, so we're not in a position just yet where we're advertising roles for that, but we are going to be doing that. I would suggest probably later this year we're going to start rolling jobs out. But that's going to be, kind of a full-scale service. So a bit of a, I suppose in a way, replica of our Oxford Centre in terms of services that we do. So, PET-CT, so diagnostics. We're going to have an MR Linac, which is really exciting as well. So that'll be the 4th. And then a standard, kind of obviously Linac as well. And then I believe we're going to be doing medical oncology.
Exciting.
Really exciting.
When you look at people's applications, just for anyone listening, what is it you're looking for so that they score high?
I think sometimes, it's not necessarily all about having a really jazzy CV. Yeah. We just want to know about you, your experience, and I think quite surprisingly as well, for instance, when we are looking for someone that is a lead, or looking for a lead, you'd be surprised the amount of people that actually forget to put kind of leadership on there. If it is a senior rad that's looking to step up into a lead role, quite often they'll not actually pop on there what they've done, and then I'll speak with them in a call, and they'll tell me all these amazing things that they've done, and I'm like, why isn't it on your CV? But I think just do keep it simple. We don't want, I think, war and peace. Keep it simple, to the point. If they really think about the job that you're going for, like I say, they do get the leadership qualities on there. Research the employer as well, like if you've worked on Varian, if you've worked on that, if we use one of those machines, kind of make sure that's on there as well. Put your basic information on there as well, because there's quite a lot of people that don't put their numbers on, which can be a bit frustrating.
Yeah. In terms of like a band 5 newly qualified, are they eligible to apply for band 5 jobs?
Yeah, 100%. Yeah, so we don't have, I would say, we do have a couple of, we call them therapy radiographers, so the equivalent would be a band 5. So we do have a couple of those across the business, but we do have certainly a lot of band 5s that are looking to step up into a band 6 role that have successfully joined us as band 6 radiographers. So they're definitely eligible to apply. I would say, usually just because of the complexities, and we do at GenesisCare, we're coming onto the workforce model. I suppose in comparison to the NHS and other private hospitals, we do work on a bit of a leaner model. Right. Typically a lead rad with, 2 per machine, a lead rad, and then 2, maybe 3 radiographers. Yeah. Obviously compared to, your private hospitals, the NHS, that's quite, so you do, need to be able to think on your feet. So for maybe someone that's literally just qualified as a band, they're probably not quite there to come to us yet. It might be a little bit overwhelming. But we're always welcome to chatting with people. We have taken people that have just qualified before, and they've done amazing. Yeah. So I think a lot of the time it is around the person as well.
Yeah.
Brilliant. Thanks very much for coming on.
No problem. Thanks, guys.
Thank you.